Coming to the causes of respiratory problems, most of the times it's viral. So that's the reason it usually subsides by itself. Though you give treatment, you don't give treatment, it usually subsides by itself. So it's usually a flu kind of a symptom. So upper respiratory tract, usually the manifestation is sore throat, cold, croup and influenza. So this usually mild and it might go away in 4 to 10 days. Okay. So otherwise, in case if it is bronchiolitis, so up to 10% of the children with viral infection may develop severe blockage of air passage and require hospitalization. Very few people require hospitalization. Usually it doesn't go to that stage if it is taken care of in the initial stages itself. If not, if the work of breathing is increased, if the child is not able to breathe properly, if he is gasping for breath, immediately to be shifted to the hospital. Clear? Next, bacterial infections. So this might be seen in the lower respiratory tract infection, where though if it is, they usually don't take chance in kids especially, let it be viral or bacterial, they usually start off with an antibiotic cover. Let it be cold or cough or sore throat or the fever, they usually, to be on a safer side, they start with the antibiotic cover. Okay. Then allergies. So allergies are very common respiratory problems. So what you're going to do for allergy is, you'll have to find out what is the problem, take the child out from that problem. But you can't do that. Many of them have problem in Bangalore itself, so you can't move out of Bangalore. So whatever is possible, we'll have to just do that. That's it. And usually allergic symptoms are clear runny nose or a stuffy nose, sneezing, watery eyes, irritability and loss of appetite. So this is the next one, that is asthma. Asthma was not at all seen earlier in children, especially a small age. Nowadays it's become common even in small children. Asthma. Asthma was considered to be the problem of elderly only in the earlier days. Once they are if they are crossing around 50-60 years of age, they usually used to get asthma. But now it has, the entire scenario has changed. It can happen in any age group. Okay. So in asthma especially, they'll be wheezing. This is the usual symptom of asthma. One is wheezing, shortness of breath. So wheezing, you can feel that hissing sound, and there is shortness of breath. There will be axillary muscles which will be active. He can't speak, he is gasping for breath. So that is the usual manifestation of asthma. Clear? And as I told you, the abdominal muscles, the axillary muscles will be active, and you can hear a high pitched sound when breathing, that is wheezing, the commonest symptom. So for asthma, what is the treatment you're going to do is, one is find out the cause of asthma first. There are some people for whom the dust, especially when they dust the house, okay, they get that wheezing attack, asthma attack. So in that condition, you have to keep observing what is triggering the problem. So if that is triggering the problem, you should totally stop that. In case you should not do dry dusting, so you, instead of sweeping the house, they should wet mop it. Just only mopping the house, so that the dust particles doesn't get flared up in the air. Okay. So whatever is the cause, you want to take the cause out of the problem. That's it. So asthma, you can't say, many people have get asthma attack because of many reasons. You can't usually make a note of it, but you have to keep observing when he is getting the attack. No, it doesn't usually cause, but it is not good. That's it. Maybe chocolates, cakes. No, some people they are allergic to egg.
Oil food also they are not having.
Some people are allergic to chocolate also, the cocoa in that. So for them, whatever is causing them the allergy, they shouldn't have it. Some kids get allergy because of even the groundnuts. It's very common. So they should not eat groundnuts also. So you'll have to check when they are getting that attack. You're asking something.
Asthma and wheezing is one and the same.
Asthma, the manifestation is wheezing. Symptom is wheezing. Okay, it's because of asthma they get wheezing. That's called as asthma. Next, pneumonia. Respiratory emergencies. Emergencies in the sense where you're going to act very swiftly. So you need to make a quick decision what to be done and what not to be done. So what are those? First, all the respiratory emergencies needs immediate attention. Okay. Then if the child, want to go? So if the child is choking with an object in the windpipe, breathing might stop for 10 to 20 seconds and there could be moderate to severe difficulty in breathing. One is choking. Okay. Choking might be because of some small object in the nose or in the mouth if it has got blocked. So here you need to give an immediate attention to that. Just check what is there and what you're going to do. I'll be discussing later, not now. There's one full chapter for that. Okay. Then wheezing lasting for more than 1 hour. If there is wheezing and if it is persistent for more than 1 hour, 1 hour is for the adults. For kids, it's even more less. More than half an hour also, it's an alarming situation where if the wheezing is persistent for more than half an hour. So there immediately you're going to shift the child to the hospital. Okay, need to shift him to the hospital. In case if you have just missed out that and if you see grey, mottled or blue skin present in the finger, nail beds, lips and earlobes. So this is the next stage of wheezing where there is wheezing for half an hour of time, more than half an hour of time, and the oxygen exchange has not happened. What that does is it has totally blocked the vital structures of your body. So that has led to the decreased oxygen supply. When you have decreased oxygen supply, in the peripheries it shows as blue or grey, bluish discoloration around the lips. You will have greyish and the bluish discoloration in the nail beds. Grey mottled skin, you will have grey skin. The child starts appearing blue. If he is appearing blue, that means it's an grey. Some may present with drooling, with trouble breathing, or child is not able to make sounds or cry. This usually happens in case of choking. Some children, there's something he's not able to express, he's not able to cry, he's not able to make sounds because it is just blocked here. Okay, so that means that's also a respiratory emergency. Immediately you're going to shift emergency, because if the oxygen supply to the brain, it ceases for more than 3 minutes. Okay, if your brain doesn't get oxygen for more than 3 minutes, that can lead to brain death of the cells, can lead to brain death. Okay, so that's the reason it has to be considered as an emergency. So coming to the treatment, so what you're going to do is keep the room temperature comfortable, as hot and dry environment will increase the nasal congestion. So you have to keep the room temperature very comfortable, little bit humid, not too dry, not too humid also. Okay, and prevent dehydration by encouraging children to take as much fluids as possible in case if he is conscious. In case if the child is conscious, ask him to drink lots of fluids. So you need to keep the child hydrated. That means give him more number of fluids, more amount of fluids. And if there is fever, so you have to reduce the fever. Don't let the fever go beyond 104, 105, because that can lead to encephalitis, that is fits, usually what we call in the layman term, very common among children. When the temperature rises, it can causes the fits in children. Okay, and use a vaporizer or a humidifier. So you get nowadays, you get that steam inhaler or all those stuff. So for some, you can also use this nebulization. What we call is the nebulizer. That's very good for children. Than the oral medications, nebulizers are the one which can do wonders. Because that is targeted only to the lungs. And it is more effective, very faster. So even though he is having wheezing and all this stuff also, it responds very fast. Okay. Then use saline nasal drop